blood culture collection. So the important things that we need to remember when collecting blood cultures, here are the bottles here. You always want to inspect your bottles prior to drawing your patient. So you want to make sure that you have one that has the lid on it, and also that there aren't any cracks or anything within the bottle itself. So these are the different types. We have the adult set, which is 2 bottles here. You got the PD, which is the anaerobic and aerobic bottle together in one, which is pink. And then you have the mycology for fungal growth bottles here, which is the reddish color. All right, so quick thing, you want to make sure if the room has a fan in it, which you really don't have to worry about that. You want to make sure you turn it off before you start any cleaning, because you don't want any dust or anything to be kicked up by the fan that can contaminate the area that you've just cleaned. So when you're cleaning, you want to ensure you can use ChloraPrep or alcohol. Is that what you use here? Different floors probably have something
No,
different.
we always use ChloraPrep unless they're allergic, and then they need to do the iodine and let it dry completely.
So when cleaning, you always want to make sure that you, when you're cleaning, you want to make sure you allow the solution to completely dry. The reason is because if you stick the patient while the solution is still wet, you can kill the bacteria that, if the needle becomes contaminated with the cleaning product, it's going to sterilize any bacteria that could be going into the blood culture bottle. Not only that, it can also cause some hemolysis if it comes in contact with the cleaning solution. So you want to ensure that the cleaning solution is done, and that you've already identified where you're going to stick prior to cleaning, because once you refill the area for the vein or whatnot, you will have to redo the re-cleaning all over again. So you want to make sure you identify where you're going to stick, turn off any fans or anything prior to sticking the patient. When filling a bottle for PDs, you want to fill with 1 to 3 milliliters. And on here, there's notches on here. Every notch is 5 milliliters, and it's hard to tell on here exactly where 1 to 3 milliliters is. So I do understand that y'all use syringes when you're pulling from the patient, so you can gauge from the syringe how much you're inoculating in here. Whenever you inoculate, of course, you're cleaning the top, as it demonstrates here in the picture. You want to make sure that the top is completely dry with the cleaning products before you inoculate, because again, you're going to kill anything that you're inoculating into the bottle if the needle becomes contaminated with cleaning products. I think that's with labeling. You want to ensure that you place the label. You want to leave this visible for the techs to see. You don't want to cover this large barcode, because the techs do use this barcode to scan within the department. So you want to place the label going vertically, like over here, just where you're not covering up this large barcode or this space here. So, or you can actually place it here. And so this is all the data that we have for blood culture contamination. As you can see, we've made great strides within Galveston, or just a UTMB system as a whole. Earlier this year, or last year, ED, we were at 3%. Now we are below 2%. And one thing that we did find out, for any time that there is a blood culture that's contaminated, and we still have to do a full workup on that blood culture. We have to identify the organism, not just identifying, but we also have to do sensitivities on the organism, and then the patient has longer hospital stays because we may think there's an infection going on in the patient. There really may not be an infection, and because of that, if there's a false contamination or contaminated blood culture, this can increase the patient's length of stay as well as their cost by $2,300 to $11,000 per report. So, yes, it is a lot. Do you have any questions? I do it all the time. No?